Then I guess we can move on to Behroopia.
Yeah, yeah.
Did you watch it?
So I watched like the first two episodes.
Mm-hmm.
Um, I'll be honest, that surprised me. Um,
Okay.
you know, a dissociative identity disorder. I don't know if you want to tell the people like what Behroopia is about or
So
uh
Behroopia is a new drama that just started a couple weeks ago. It's written by Rida Bilal and features Faisal Qureshi, who's been there for a while, and then Madiha Imam. And Faisal Qureshi is shown to have dissociative identity disorder, which is also called the multiple personality disorder, because he's had childhood trauma. So
yeah.
basically, that's what it's about.
Yes.
So,
So
what do you
when you
think about that?
yeah, so when you asked me about this, like, my instinctive reaction, because I did my training a long time ago, was, oh my
Yes,
God,
yes.
are you kidding? I don't even know if this, like, because for a long time in the psychiatry community, psychology community, DID
It was
was a very, like, does this diagnosis exist? So I did a little bit of
controversial
research.
too.
It was controversial, right? And so I would say that the consensus now is that it does exist.
Mm-hmm.
It is still rare. The statistics I was reading was that it has about a 1% prevalency rate, which is about the same as schizophrenia. In clinical practice, when I talked to some of my peers about this, that's not what we're seeing. You definitely see a lot more. I've never seen, and I've been practicing, like, if you count residency, for about 20 years now.
Yeah.
Um, I've never had a patient with DID.
I did see
Schizophrenia.
like a case report in South Korea that they had reported in
Hmm.
2000, I think maybe 2022 or 2023. It was in the Journal of Psychiatry that I did see. Like
Oh,
there was just one case report. Yeah.
yeah. I mean, no, and
So,
like when I was kind of looking stuff up, like at least in America, there have been cases. And
mm-hmm,
so
mm-hmm.
the diagnosis does carry more validity than I think maybe 20, 30 years ago it did, because there's been more research, but it's still not a very well understood condition. Um, so in terms of the way they reference, so I guess one criticism I would have is, why did you pick DID of all things to portray? I think that's more for entertainment purposes, because if you're trying to make a comment about mental health in Pakistan, pick something that's a little bit more common, something that's a little bit more prevalent. Like if they had decided to showcase schizophrenia, that would make more sense to me. But, DID is a very it has a lot of entertainment pull. Like, we have in the West, we had Split. I don't know if you saw that movie,
Yeah. Mm-hmm.
right? Like it is a very it's the more fascinating kind
That's
of
yes.
condition,
And then
right?
you've got this one actor playing nine roles, so that also
Right.
brings the audience, right?
Right. Like that's a juicy role for an actor, right? And
Yeah.
so
Mm-hmm.
so I guess, from that mental health perspective, that would not be, if you were advocating for better mental health representation through an entertainment media like Pakistani dramas, I would not say start with DID. If you want something
Um,
for entertainment purposes, okay, fine. I get you pick
Yeah,
DID,
I mean, I think
right?
I think the writer said that she wanted to like portray about or discuss about the child abuse.
Then you could
Yeah,
have given the person PTSD. You could have given
PTSD. Yeah,
them, yeah, you could have
mhm.
given them major depression, right?
Even with psychosis, is
With
that's
psychosis, yeah, you can give
right.
them major
Yeah,
depression with psychotic features. There's still a lot of other ways you could have gone with a traumatic background, and I think it's a little disingenuous to not admit that you might have picked this because it does have entertainment value, which is fine. I mean, you want people, I
hmm
get it. Like, you want people to watch the drama,
right. Oh
that they're,
yeah.
but then, but if you're going to say, I really wanted to bring, light to mental health through dramas,
Okay,
okay, yeah, you
that's
did, but
not
you also picked something that's not as common and maybe might not as resonate as much with the Pakistani community, or with any community, frankly speaking. It's not that common. But I would say
right.
I was surprised, like after I did my research, that it wasn't poorly represented in the drama. I mean,
hmm
there were some glaring mistakes. When he sees an altar, like it's at the work meeting, and
Yeah.
he splits, I guess. I'm not sure what was going on, if he sees an altar or he was hallucinating, and his assistant comes and gives him medication and it goes away immediately. Yeah, that's not how that works, right? Like, just
Yeah.
from a physiological perspective, that's not, you don't give someone a medicine and their hallucination
Exactly.
vanishes right like that.
Right.
But in terms of what, it being rooted in trauma, very true. The person, um, traditionally, DID has been associated, you would think that the alters don't really have an awareness of each other,
They do
um,
sometimes, right?
but sometimes they do, right? And so that's what
Mm-hmm.
they were showing more. Alters. are protective. They are meant to, protect from a trauma response. And they were bringing about the mental health conference, uh, and they
Oh
were
yeah,
talking about,
yeah.
they were
That was
talking about
good. That was good,
that
I
was
think.
good. Yeah, they were talking about integration. So if I was pleasantly surprised. I
Yeah.
was going into it thinking, oh my God, this is, and I do think that there were some, some things they missed. I mean, but still not bad, to be honest with you. Um,
Hmm.
I wouldn't have chosen it, but that's, but
Yeah.
for entertainment purposes, yeah, not bad. Mhm.
Not bad. Okay.
Yeah,
Hmm.
I mean, given how much we know about DID, right?
Yes, exactly. And like we
Right.
don't even have like treatments, I guess, like
I
except for
mean, like,
therapy.
yeah, therapy, like the role of medication. That's where I was kind of like, why are they giving him like is if he
Like
if
what
he's
medic
I don't know what medicine they gave him. And I don't know if he was hallucinating or seeing an alter, but no medicine is going to kick in
anxiety, like that's the only thing you can think
for
of.
anxiety. Yeah, but he wasn't
Right.
like he was seeing something, right? So if they give him an antipsychotic, it's not going to work within seconds. And that's
No, no,
kind of
no.
how it like, if it was an anxiety response, he would be having more of a panic attack. That's where if you were going to give him something short acting to
You're right. It's
relax
like
him.
yeah, yeah.
Right.
Hmm.
So there I was kind of like, oh, well, that's not how medicine works, but
Yeah.
okay, that's fine.